Hi everyone, this is Ligia again. I was really missing to make the videos, but I was really busy with treatment and with work and studies, so I have to stop a bit. But now I am back, and then since I started my treatment with the chemotherapy for my breast cancer, I received some message, and one of them was like some other girls that unfortunately they discovered they had cancer just before I exposed my story. And one of the my patients from Brazil, she contacted me and she said, look, I saw your video, and just straight away after I discovered myself I have cancer. And then she started treating, and she really appreciates some tips that I gave to her, and then she's now being able to deal with the treatment much better than she thought. And then I contacted her back, and I asked her to give me some to ask me some questions that about the treatment and how because sometimes you feel concerned to ask to the doctor, sometimes you forget asking them. And so I asked her to make a couple of questions for me to answer, and to see if I can help her and other people that might have like a curiosity or feel concerned about asking. So one of the things that she asked me, it was very important. She said that at the very beginning of the treatment she started feeling a little bit sick, so she wasn't willing to do much exercise because her body wasn't coping with that. But then in the half part of the treatment she was already happy starting doing gym, but she didn't feel comfortable because she was bald. Oh, I know what it is. So it's like now I love my hair. I used to love my bald hair. So for people that are like following me in the Facebook and in the videos here, they see that for me it wasn't that big deal to expose my baldness. But at the beginning, the very first time I decided to do that, it is like a whoa. I don't want people feeling pity about me, and I want to be the strong woman as I always been. And it is like difficult to expose yourself in that way. So this tip, like if you go to a wig store or if you can buy via internet, there are some hats like that you can have with the hair in the back part. So you can have like a cap sort of thing or a hat sort of thing that has the fake hair here. Then you can have like a ponytail, and anybody will see that it is a wig. Generally it's much more affordable than if you buy a wig, and it is much more comfortable. It's not as hot, but it is very nice and tight in your head, as much as a normal wig. Who wears a wig knows that it fits very well. You can even put like a wig cap before, then it will be much better, it will be okay. For this, like when you feel too sick for doing exercise, you shouldn't force yourself. She asked me what sort of exercise, as being a physio, what do I advise people to do. Well, I advise first of all doing exercise. For sure, if you are not in your best day, you don't force yourself. But if you are sedentary, if you are not very, this is a very good moment for you to start doing exercise. Then you don't need to force yourself, but as I said, it's like if you've never done anything, you can go for a walk and then you see how you feel, and like push yourself a little bit to put your body in something that your body feels that is doing something. If your body doesn't feel that it's needed, then it's much more likely for you to feel sick. Your body has to understand that you need this to do something. So if you are used to run, there are people that are still running. I love Pilates. I'm a Pilates instructor. I was her Pilates instructor at the time. I love Pilates. So this is a very good tip. It is a very safe exercise. My doctor said moderate to hard level exercise, so I didn't stop because of what made me stop a bit. It was because of the bladder problem that I will tell in another video, but I'm almost 100% better, and I could, for the people that were following me, I was just pretty much okay with doing exercise. I was very happy with that, still doing. So yeah, so about exercise, keep doing. If you feel sick, like if you green apple, it's something that it is really good to calm you down. Also green juice or whatever juice, but without the fiber. So if you can go for a store, a restaurant, and order a juice that have no fiber in it, so your body doesn't have to digest, and then you have one thing at a time, because if your body is digesting too much and already having to deal with the chemo, sometimes you will feel very heavy. So juicing, it is something that will help your body to absorb all of the nutrition, but at the same time you will not feel like a very heavy in digesting. So it's a good tip. Then she started asking like what the sort of treatment. I will make another video about how I clean my skin and what the treatments that that I use for my skin. But one thing that she asked is like, what about the sunblock? And everybody says for you to use the sunblock, the sunscreen, but nobody says for you to protect yourself from the sunscreen. And some of them has in the formula some sort of estrogen, or also some some products that will tamponate, that will block your skin, so your skin will not breathe properly, and then you will have all of the toxins blocking. People that likes wearing makeup, you know. So we have to exfoliate the body, to scrub the body, and to clean the body after we use that. And one thing that it is very good, especially to not have any mark from the sun and from the cream, it is to have a zinc-based product, because then it will not increase estrogen, and it will be a way better for your skin. It will help to heal it, and it is very safe too. And then this is a very, I will say in another video, all of the benefits of the zinc and all of the importance of the zinc for your diet and all of that. It's really good to have it, and it's a little bit more expensive than the normal one, but definitely it's worthwhile, especially for face and for the chest area, that it's more exposed to the sun, right? What else? She started asking like about the radiation. She says, oh, there are some people that have that says that they have side effects, and some others says that it's achiness or burning sensation. What is that? The feeling. To be honest with you, I pretty much don't feel anything. You know, I mean, this is my right breast. I can move properly, all good. The very two first times I felt a little bit high after the radiation for about 30 minutes. After that, ever since, I haven't felt anything. I haven't missed this. No, I'm joking. Yeah. So I do believe that also it is your mindset when you are receiving the treatment, because as I was saying in the video that I've done before in Portuguese, I do feel like an X-Men when I'm there. So I really enjoy the thing, you know. It's like because you were there and then you had all of the machines coming around you and all of, yeah, you know. So if you go for like a light mindset and play with the thing, you will not feel that much. But definitely if you still like thinking too much about it, it's more likely for you to feel more things. And then, yeah, you could feel like a burning sensation, you could feel pain, but it is very, very personal. Every person copes very differently. When I am there, what happened is that before the first treatment, they do a tattoo. They tattoo you like a dot, some dots on you, just to make sure that they will always radiate in the exactly right spot. And so it is a little bit awkward and weird at the beginning, because people are just like looking at you and seeing you putting your breast exactly, you know. So it's just like a little bit awkward at the beginning, but then they leave the room and then you stay there just like with all of the machines, and then it's like yeah, I do feel like a mutant, you know. I feel like an X-woman. So yeah, the treatment takes like 3 minutes, not even. Because of my cancer, I had to go for 33 sessions, but it depends too much on your case, because every case is absolutely different. So, yeah, then, well, the sensation for radiation is that she asks, why do you need to go for radiation even though you don't have the tumor any longer? This is a very important question. A lot of people ask me why I do have to go for surgery as well. And, well, the image exam only shows already when you have a mass, or when you have a tumor mass. So if you don't have a tumor mass, but you still have one cell that is cancerous, and they don't open up to see it and to clean it, then you are likely to have another cancer or another tumor after that. So they really have to open to clean very much inside, and they will treat like if your tumor it is like at that size, even though it is like shrink or don't have any longer, they will cut a little bit more than the size of your tumor over there, just to make sure that you will have much less chance to develop it. And then after that you go for radiation, and the radiation will also do the job. Like in my case, I have radiation where I had the tumor, where I have the lymph nodes, cancerous lymph nodes, and here I didn't have any cancer, but I still have radiation here because it is the closest place that the cancer could migrate. So they also, like in terms of protection for me to have less chance to develop other cancer or to have a metastasis from this cancer without they having checked, because before they didn't know that it was so likely for it. And depending if your cancer it is very aggressive, they want to shuttle down like as fast as they can for you to have less chance. So now after the surgery, I had like every woman have more or less 10% chance of having breast cancer if they don't have any other genetic condition that could increases this percentage. In my case, because of the surgery, I have still 10% as much as the other women, but in this breast, because of radiation, it lows down to 1% for what my doctor said. So it is like I'm less likely to have another breast cancer in this breast than in a woman that never had a cancer before. So this is why it's that important to have the radiation still, even though you don't have the tumor anymore. And she asked like, do they take off the main lymph node? Well, it will depend. If you have cancer in the main lymph node, for sure they will take it. If it is you don't have in that lymph node, but you have in a lymph node that is very close to that one, they might take it off as well, because they will always try to protect you as more as they can. So if they see your picture, because everybody's absolutely different case, you know, and it spreads very differently. So seeing your case, they will always try to protect you as more as they can. So it could happen. She asked because in my case I have lymphedema, which is like I have pain, and then I was protecting my arm, so I was like, oh, and then came a lot of liquid in here, so it was like with edema, you know, with fluid, with liquid here. So I drained it myself because, you know, I'm a physio, or work with that. I used to work with that before, so I drained myself in about 3 days. I was okay, but here I have a little bit shortened muscle, so I have another girlfriend of mine that is also a physio in Brazil, but here she works as a massage therapist, and she unlocked this doing a technique called myofascial release. So in 1 day I was pretty much like all perfect. So still doing well. So if you know that you go for surgery and you have to go for radiation and you are concerned about that, my tip for you is to go for a physiotherapist that knows how to do lymphatic drainage and to already arrange to go with a straight way. I've done myself 1 day after surgery and all good so far. Another thing that she asks is that the nurse told her they could replace the breast for fat tissues. She asked like, is that always like that? Well, depends. It's like in here in Australia, the government doesn't give you prosthesis unless you pay it for it, or even the surgery to have like a fat tissue from other parts of your body and to replace in that area. It is like you have to have a plastic surgery, and it's much more expensive to have this. So if they have to take off the whole breast, that will be some perhaps what the doctor will offer you. But in my case, because it was local, it shrunk very much. So the doctor were happy. We just do a partial mastectomy, which is to take off that piece. So I have a scar in here down the bottom. I have another scar here, which I really don't mind. I'm happy with them. So what happened is that I will have this surgery, this scar forever, but you know, still like a same size, don't have much difference in terms of anatomy. But if you have a case that you have a little bit more, then depends too much on the country and the sort of techniques that your doctor can offer you. So nowadays, like before, they used to just to use the silicone prosthesis. Nowadays, it is like a more natural to go for fat tissue, and also the fat tissue will decrease more the chance for you to have breast cancer again. But you will be already, because of radiation, with less than 1%, depending on the case, you know. So it's like because nowadays we go for the whole protocol of treatment as patients, so it is much less likely for us to have another cancer or to spread, because nowadays they have this mindset that we have to protect ourselves as much as we can. Rather, before, they didn't know that could be that they could prevent somehow, so sometimes they stop the treatment before going for all of the steps. So that's how nowadays that it's like a much more people that survive and can deal with that with having no cancer any longer. So yeah, so it will depend. You have to discuss with your doctor what is the best option for you. In my case, I didn't have to go for a full mastectomy. I just had a partial mastectomy, and they took like this edema that creates in here. It's because I'm a little person. So since I'm a small person, and here I had like they took more or less 10 lymph nodes, which for me it is quite a good amount of thing. They used to, you know, to look after a large part of my body. So because they took off those 10 lymph nodes, it was easier for my body, and because I was feeling pain and I was sleeping like that, we have to lift up the arm after surgery to allow the liquid to come down. So even with that, the liquid like came and settled here. So as much as you can have it high and have the drainage, and then it doesn't become chronic, so you don't have to worry about that. But you have to talk to someone that works with lymphatic drainage before the surgery, because then you can arrange to have the surgery and straight away after you already go for treatment. And I think that's it. Okay, so if you like it, you please just join Time's Up. And if you have whatever other doubt about the treatment or about I will give other tips about diet and about skin treatments. So just please keep checking, and I hope you enjoy it.